My name is Brandy Butcher, and I'm doing assignment 3 for Sim 436, which is critical thinking. So, I wanted to tell you about a time in which I was a brand new grad. I had just graduated from Ohio University in 2013. Now, I was an LPN for 5 years prior to going to get my RN, but all I had ever done with my LPN was home health. And I greatly enjoyed home health, but I knew that I wanted to do critical care. So I decided that I would move into the hospital and join the float pool med surg, so that way I could gain more experience and to get more understanding of how the time management works, and just was super eager to learn and super eager to take in all the new knowledge and everything in which I was hoping to gain by this new position. So in the hospital, you work 3/12s, and you have your days off. I was fairly new. I'd probably been working there for a couple months. And I worked on 13 different med-surg floors. So each floor, of course, was different. They each had their own kind of like specialty, like ortho and cardiac and surgical, pediatrics. They each kind of entailed a little bit of different things. So one night I worked night shift, so 7P to 7A. One night I was assigned to work the cardiac step-down floor. And I had done this many times before. It wasn't, the first time I'd ever worked on that floor. I will say that given that I was a brand new RN, I definitely lacked the confidence and the knowledge that I have now. And I had never experienced anything like this. So I got a report from all my patients, or from all my my coworker about all my patients. And the first thing that I always do is I usually go early anyhow to look at the chart, to get logged in, to get, I had a report sheet that I like to fill out on each patient, what I have to do, what medicines I need to give, what all that basically that I needed to kind of stay on track throughout the whole night about. So, and then after I do that, I get verbal report. We did not do bedside reporting. We did kind of like out in the hallway in these little cubbies, and we got our report from everybody. And usually when you get your patients, like not one nurse has it, you're getting a report from several different nurses. So I got one patient that afterwards I went and seen all of my patients. I went and seen them all and kind of just check in and say hey and do a little pregame before I go and fully assess them all, just to make sure that they know that we've changed nurses, and that I'll be the new nurse, and if they need anything, that this is my name, write my name and stuff on the board so they'll have it. Well, I went in to this patient's room, and she was, and the other nurse, had given me a report, and she kind of we didn't go over everything in which I thought that I needed by the time that I got in there to see her. Now, at the time, I thought that it was a good report and stuff, but when I got in there to see her, she really wouldn't respond to me. She was kind of crying. I asked the charge nurse about it, and she actually said that that has kind of what she had been doing, that was what she's been doing for the day. So I said, okay. So I went and I did all my evening med pass. I advised the patient that she had scheduled pain medicine and that maybe that would help with her pain. So I gave her pain medicine, and when I went to reassess, she was sleeping and appeared to be resting comfortably. A little while later, she was in there kind of moaning, so I went in to assess her. I went in the room. I asked her. She again didn't really respond to any questions, but I was unable to find anything notably wrong with her. Like, she wasn't. Her blood pressure, all of her vital signs were good. Her lungs sounded fine. I did a neuro check, and it was okay, other than that she wouldn't speak to me. She just kind of kept moaning. So I did call the doctor, and I asked them to come see her because I had given her the pain medicine. She went to sleep, but still I felt like something was wrong. I didn't really know what it could be, and I, kind of felt overwhelmed. So they didn't want to come see her, said that they would put something in for her to calm her, and so that's what they did. They put in some anxiety medication. And so I went to the Pyxis and I administered the medication. I went to check on her again, and she was calm. I noticed that she was kind of sweating a little bit. She does not have a history. No history of diabetes or anything. So I did feel like I kind of thought that her sugar might be low or something with her sweating the way she was. So I checked her blood sugar, and it was low. It was like 40. So I called the doctor taking care of her. Now, with that being said, we are a teaching hospital, so we have residents on call. We do have an attending that is usually, there may be one attending there, but they're kind of taking care of the whole service. So they don't take care of everything the residents do, unless the residents get into trouble, and then the attending, of course, comes to help. So, did her blood sugar, and it was 40. Called the doctor immediately. They ordered an AMPA D50. I administered the AMPA D50, rechecked every 15 minutes, and her sugar, of course, was way better after that. She still wasn't any better. She wasn't talking to me, but her sugar was better. So, of course, I waited another 15, 30 minutes, checked again, and it started to get low again. So I called the doctor and asked them to come see the patient again. So this is the second time now that I've asked them to see the patient, that something is wrong, and I want them to come see her. So they decided that they would just put in a dextrose drip to kind of keep her sugar where it should be. So I, again, followed what they had directed me to do. I got the dextrose going, and it did. Kept her sugar the way it was all night. It was at a continuous rate. I checked her sugar every 30 minutes to an hour, and it was normal. I continued to check on her all night. She didn't get any worse, but she also didn't get any better. The team of doctors, so like at this point, it's the attending and all the residents. They rounded at 6 a.m. They were worried about how she was presenting, and they sent her to the ICU then. So, according to our textbook, that our critical thinking textbook in which we were using for this course, the chart, the critical thinking tactics for nurses, the chart on page 140, box 5-4, is a guideline for analyzing critical thinking in an event. With that being said, I did the chart, and I got an 8. So, which means a deficit in critical thinking probably contributed to the event. Absolutely. I lack the knowledge, I lack the confidence in my nursing ability to properly help this patient. And according to the the standards of nursing, I personally should be an advocate for my patient in which can't speak for themselves. So I had researched an article from the NCBI, and it states that it is revealed that nurses are able to empower vulnerable patients, delivering them from discomforts, unnecessary treatment, as well as protecting them from actions of incompetent healthcare professionals through advocacy. I personally was that incompetent professional. I should have took it upon myself when those doctors did not come to see her to call a rapid response, because I knew something was wrong and I did not do what I felt I should have. I don't know the outcome of this patient. She went to the ICU. I don't know if she, lived or didn't. But I feel responsible for the care in which I gave, which was not what I would do now. As far as the steps to prevent it, I think that if you do have new nurses, you're always going to have new nurses. They're always going to be starting, and which is great. We need nurses, but they need time. They need guidance. And I think as a manager or leadership, you need to be personable. You need to make them feel that they can come to you for anything, especially on a night shift. So if I would have also just went to the charge nurse and insisted that something be done, then that also could have changed the outcome of things. But I went to the charge nurse and she said she was like that throughout the day. But still, there just needs to be more communication. And with us being a teaching hospital, those doctors should have came and saw her, but I should have insisted more instead of just blindly following their lead of, they put it in, so I'm going to go give it. So, but now I definitely do a more thorough assessment on all my patients. I definitely know when something is wrong, and I follow my gut and my intuition a lot more now as a nurse. I feel confident in my ability to assess my patients and to give them the best care possible. And I am an advocate for my patients. I now do more, I do adults, but I do more pediatrics. So definitely they don't have a voice at the ages in which I do, and they need someone to care for them. So that's my new role, and I feel much better about the current situation in which I work now. And I feel more confident and capable as a nurse and as a healthcare professional. So, thank you so much.